Hello, my name is Deepal Dalal and I'm at the Desert Food Conference in Phoenix, Arizona. I have with me Dr. Anthony Tickner, who's giving a great series of lectures today, and I thank you for your time and thank you for being with us today.
Absolutely. Thank you for having me.
Of course. So I had a few questions for you regarding the conference. I know you're one of the chairmen and very intimately involved with this conference. Can you tell us a little bit more about why you got involved with the Desert Food Conference?
Yeah, so I've been working with the Present crew for a while, a few years now. Michael Shore and Darren and Daryl and Alan and our wonderful support staff, and you know, it's I do a lot of traveling and I do a lot of conferences throughout the year, internationally and nationally.
Right.
And the reason I like to do work with the Present people is you truly do get a multidisciplinary approach. We have VA practitioners, we have nurses, podiatrists, vascular surgeons, we have medical assistants, we have physical therapists, so you truly can come here and get the information you need.
Yes, very good. I know one of the things you talked about this morning too is the multidisciplinary approach in the panel. Can you expand on how you implement that in your own practice?
Yes, so I'm the medical director at our hospital, and we have 17 providers, physicians. We have about 8 nurses, 2 front-end coordinators, and 2 HBO techs. So we're very busy. We see over 200 patients a week in our facility, and we're able to have somebody come through the door and quickly get them the support and the help that they need. So if they need surgery, we can refer them to one of our providers. If they need vascular intervention or infectious disease, we're able to get everybody there under one roof, so to speak.
That's excellent. And then I know that a lot of the lectures you're doing today are with the AAWC track. Can you tell us a little bit more about that?
Sure. So the AAWC is collaborating with Present this year, and that's the Association for the Advancement of Wound Care. It's the largest multidisciplinary wound care organization in the world. We have over 2,000 members, and it's multidisciplinary with podiatrists, vascular surgeons, nurses, NPs, PTs, you name it. So what we have, we've had a wonderful relationship with Present in the past, and myself personally and some of our other members, but this year is special because it's the first year that we're actually, we have an AAWC track. It's a full day track, and we have anything from exercise and physical therapy to neuropathy to best practices to compression to casting patients with diabetic Charcot neuroarthropathy, you name it. So we cover every aspect of what we practice what we preach, and these are things that you can take home for Monday.
Great. And then you're doing several different lectures today, and that's very impressive. I don't know if I could lecture so much in one day, but I was wondering what your favorite topic that you're lecturing on today is.
So, you know, that's kind of a loaded question because I don't like to do anything that I don't enjoy. To give you a vague answer, I like them all, but I do kind of gravitate towards the diabetic foot and offloading the diabetic foot, and we're currently involved with some research as far as total contact casting and offloading the difficult foot. And we'll hear more about that later with myself and Tom Serena. So,
excellent.
Yeah.
If you had to recommend a colleague to come to the conference, what would be some advice you could give them on why they should attend Desert Food Conference?
You know, that's a great question, and I think the reason I love coming to Desert Foot and you know, it's so beneficial for me is because not only can I network and catch up with people that I haven't seen in a while, but it truly is a conference for everybody. We have a lot of VA people here, so they can get information on different products and different implementation of diagnostic issues and products into their networks and their systems. But we also have starting this year with the AAWC collaboration, we have nurses, we have physical therapists, we have more DPMs, we have more wound care practitioners, and it truly is a conference for everyone. We have probably a record number of vendors, and the attendance is astronomical this year. So you are going to get something that fits within what you're looking for. I also have one of my residents here from our hospital in Boston who did a poster and traveled with me. So the education is there. It's state of the art. It's up to date. And if you need any support or any guidance, everybody here is wonderful. And it is truly a place to get the information you need.
Excellent. Well, thank you so much for your time and for lecturing with these great lectures today.
Oh, absolutely. My pleasure.
Excellent.
Thank you.
Again, this is Deepal Dalal from Desert Fit Conference. Thank you so much for your time.